Welcome to Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health. I'm Joshua Sharfstein, Vice Dean for Public Health Practice and Community Engagement, and a former health commissioner here in Baltimore. Our goal is to bring evidence and experience to illuminate critical public health issues. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes.
Hi, I'm Lindsay Smith Rogers, producer of Public Health on Call. Today, we're discussing how states and municipalities can responsibly spend billions of dollars from opioid settlements. I talk with Sarah Whaley, a coordinator for a project called Principles for the Use of Funds from Opioid Litigation, about 5 guidelines for spending funds in ways that actually address the nation's opioid epidemic. Learn more at opioidprinciples.jhsph.edu. That's opioidprinciples.jhsph.edu. Let's listen. Sarah Whaley, thank you so much for joining us on Public Health on Call. You are one of the coordinators of a project, Principles for the Use of Funds from Opioid Litigation. Can you start by telling us what you mean by funds from opioid litigation?
Yeah, Lindsay. So the funds from the opioid litigation are dollars that are going to come down to states, cities, counties from over 3,000 different lawsuits where the plaintiffs are these cities, counties, and states and sovereign nations. And they're suing the defendants who are big pharma. These are the big players in opioid manufacturing, distributing, and then the retailers. So these are pharmacies like CVS, Walgreens, and Walmart. So the lawsuits are going to eventually end, and there will be dollars that come down from them to these localities.
How many dollars are we talking about here?
Yeah, so it's still in process, but we're estimating somewhere around $32 billion.
And some of this has already come out, right?
Some of the lawsuits have been finalized, and then there's the big one, which, is against the big 3. It's called the MDL, and that's around $26 billion. There's still final things that are coming down, so it depends on how many municipalities or entities sign on, but somewhere around $26 billion.
And when you say the big 3, are those manufacturers?
So those are the distributors. That's McKesson, AmerisourceBergen, and Cardinal Health.
And when do you expect to see that amount of money coming out?
It should be finalized pretty soon. And the first round of funding should be coming maybe in the next couple months. We're not totally sure, but probably by fall.
So you've got these municipalities that are suing big pharma, they're suing manufacturers, all these things, and they're getting settlements from these court cases. And so these principles are to inform people who are making decisions about how to use this money. What are these principles? Can you walk us through those?
Yeah, so there are 5 principles. They're very high level. We think of them as like building the foundation. So before a state or locality can make the decision of I'm going to fund X, there should be some things in place that protect the dollars and make sure they're going to the right thing. So 5 simple principles. The first one is to spend money to save lives. We want these dollars to go towards the opioid epidemic. And so there are some things that states can put into place to protect the dollars. The second one is to use evidence to guide the spending. We have a lot of research around what works and doesn't work. And so ensuring that these dollars go towards the programs we know work is foundational. The third one is to invest in youth prevention. Good public health strategies have a prevention approach. And so ensuring that these dollars intervene before people start using drugs, great approach. Third one is to focus on racial equity. We know that there are communities that have been differentially impacted by the opioid crisis. And so as decision makers are thinking about how to spend these dollars, really focusing on those communities and putting these dollars back into them. The last one is to develop a fair and transparent process. So this is including folks with lived experience and other people that know a lot about the process, and then just making it transparent to the public.
What inspired these principles? Where did they come from?
Yeah, so they came from a lot of different people, and there's a lot of work being done in the states. So the project I work on is called the Bloomberg Overdose Prevention Initiative. We do direct state technical assistance and evaluation. And in our conversations with states, they started to ask us a few years ago, like, how do we spend these dollars? And connections that we had, partners that we work with in these states, were getting similar questions. And so before we started to do that technical assistance of saying, hey, you should fund a syringe service program, we got all these folks together and started to think about, well, what are these foundations that should be in place before those decisions are made? And so collectively, we got a group of experts from across the opioid space, folks from the prevention community, the harm reduction community, the recovery community, and built these principles from there. They have now been endorsed by over 60 organizations across the country.
Has there ever been something like this before where you have a big settlement and then people are trying to figure out how to ethically and equitably spend this kind of money?
Kind of. In the late 90s, there was a similar public health lawsuit like this against the tobacco companies. So states were spending a lot of money on health-related causes from tobacco use. And there was a big collective lawsuit against the tobacco companies. There was a big settlement, and states got a lot of money spread out over a long period of time. And unfortunately, that money wasn't used towards tobacco prevention and cessation programs. Tracking done by the Campaign for Tobacco-Free Kids showed that around 3% of those dollars are used towards tobacco-related funding. And so with kind of the scope of where the opioid crisis is right now, we didn't want to see those dollars be lost to the general fund. So that kind of sparked our interest in making sure that these dollars were protected and used towards opioid abatement.
Well, let's dig into some of these principles here. Can you give us maybe a case study or an example of a case where these principles were used to allocate this funding?
Not a lot of allocation has been made yet, but in thinking about planning for the dollars, there's been some great examples across the country. Colorado has a really cool program that they've instituted where the principles apply. So they've created a formal agreement across the state that creates these regions, and the regions are collaborating together to pull together resources and figure out how they want to spend the funding. So the choices of how to spend the funds are going to be specific state by state, county by county, city by city, because folks have been working at this crisis for years now. And so they've already instituted a lot of things. So where these dollars can come in and be the most helpful will vary by locality. And so what Colorado is doing is they have a board. They're going through this process of weighing what's needed, what's not needed, how can the regions help each other. And it's all being made public. They have a great advisory board with folks with lived experience, folks with other experiences. And I think they're on the right track to make some really good spending decisions.
One of the principles is using evidence to guide spending. Can you talk about one example of that evidence?
So there's some great examples of research that has been done looking at programs that work and programs that don't work. One of I think the big ones are the ones we talk about the most are medications for the treatment of opioid use disorder, or MOUDs. There are three most commonly used ones: methadone, buprenorphine, and naltrexone. And making sure that there is access to these medications improve people's treatment outcomes. So it reduces cravings so folks can stay in recovery, so that they can access other services. It really helps in their transition into recovery.
So you've got a huge amount of money that is going to be coming in. You've got these evidence-based principles as to how to spend that money. How do you reach the people that are in those decision-making positions?
There's a lot of outreach that's happening. So part of all of these organizations coming together to endorse the principles is we now have this coalition of folks that meet once a month in what we call a working group. And we are trying to leverage what folks have already been doing. So, Hopkins does technical assistance in states, but there's also organizations across the country that are doing that kind of work. And so coming together, seeing what other organizations are doing that work and doing outreach around the principles, doing advocacy work, and just offering support to governments. This is a big decision. Governments have a lot of stuff going on. We're in a pandemic, right? Still. And so offering that support when it's needed, when governments are open to it, like we're here. And if we can't help you, we can help find someone who can.
There's been a lot of talk with these settlements about accountability from these big players in the opioid epidemic. Do you think that these principles are helping with that? Is any of this going to put a dent in the opioid epidemic, or how do you see this playing out?
The money that's coming out of this is a lot of money, but in the reality of the cost of the opioid epidemic and the profits that were made by these companies, the funds from the litigation are drops in the bucket, right? But that doesn't mean that they won't have an impact. And that's why states and localities should use the principles, because it'll help make sure that the dollars are used wisely and go to what's needed. So a state could do a needs assessment to see what they're already funding, where some gaps in funding are, and these dollars are an extra resource to help fill those gaps.
Is there anything else you'd like to add?
Yeah, just want to say again, thanks for having me. And these dollars are not magic dust that's going to solve the crisis, but it's an opportunity. And the principles will help to increase that opportunity and make sure that these dollars are used wisely. And we just, like you said, want that transparency and encourage governments and communities to hold their decision makers accountable and to make sure that these dollars are used to save lives.
Sarah Whaley, thank you so much for joining us.
Thank you for having me.
Public Health on Call is produced by Joshua Sharfstein, Lindsay Smith Rogers, and Stephanie Desmond. Audio production by J.B. Arbogast, Holly Cardinell, Spencer Greer, and Matthew Martin, with support from Chip Hickey. Distribution by Nick Moran. Production support from Catherine Ricardo. Social media run by Grace Holes Fernandez and Amber Bryan Singletary. Thank you for listening.